to do this. I may be a little bit on the short side, and I may be a little bit quick on this. And unfortunately, I can't be part of the Q's and A's because, as I mentioned today, being one of those crazy days, I'm off to my daughter's high school graduation, at which I'm giving the commencement address, no less. So anyhow, as you can imagine, it's going to be a wild one. But that is, so we're talking about ConOps here, right? Concept of operations for threat response. And so these lightning rounds are set up in that they really are lightning rounds. It's a flash. It's a bolt, and it's the idea that you're going to walk away at least understanding the definition that we're going by. So this is strictly definition with some ideas introduced there. So when you look up the definition of ConOps, the next few slides are really going to be definition. I really do want to get to the lexicon of the moment, right? In terms of concept of operations for threat response, right? This really is a description of how a set of capabilities may be employed to achieve desired objectives or an end state. So it's a pathway. It's a document that describes the characteristics of a proposed system from the viewpoint of an individual who will use that system. And I think this is really a key component of this, which is when you look at ConOps, it really is. It's, I got to use this, so what do I need to be able to do to achieve those objectives that I'm looking at? And mind you, put this in the frame of our topic of the moment, right, which is ultimately the idea of assessment and monitoring. So my point here is that in the midst of all this, right now we have ConOps for all sorts of response capabilities. And yet, as we talk about all these other things in these lightning rounds, right, other capabilities is how do we build in the use of big data, electronic health, right, data, information sources, clinical networks, right? These can't just be stay alone. Right? You'll talk about your own definitions. My point is that everything that we talk about ultimately has to be written down and has to be provided so that an individual can understand where are we going. It's the concept that we talked about earlier, coordination at all those levels. And coordination not only, as I mentioned, the local, state, and national level, but in essence, coordination with all the stakeholders, the industry component, the sponsor of said product, with the local health authorities who are with the Strategic National Stockpile, with the pods, the agencies that are responsible for responding to these emergencies. Also, ConOps are used to communicate quantitative, qualitative system characteristics to all the stakeholders, right? It's widely used in the military, in governmental services, and in other fields. So the term ConOps has multiple uses and multiple definitions within those systems. Its goals, its objectives of that systems, its strategies, tactics, policies, and constraints affecting the system, organizations, activities, and interactions amongst participants and stakeholders are well defined. Right? So what we're talking here, it goes back to what Carmen talked about, is that it's no longer just the feds, i.e., for example, FDA, dealing with a single product sponsor. Built into these ConOps has to be the sense is if we are expanding the universe of interactivity to achieve those goals, that has to be built into the ConOps. Who am I speaking with? When am I speaking with them? What data are we getting? Where are we getting it? In what manner am I getting it? In what time period am I getting it? So from a ConOps perspective, this really is a flow of events. It should be relatively clear in those ConOps. Complicated to set up, complicated to organize initially. But at the end of the day, everyone involved should understand their responsibilities and the authorities placed upon them. They should know the specific operational processes for fielding the system, for having it move from a piece of paper to reality. Built into that is initiating, developing, maintaining, and retiring the system. So it's the veritable alpha to the omega. The beginning to the end of a flow of an event should be delineated there. How do we start? How do we catch up to running speed of getting this information? And when it's over, how do we shut this down? And to a large extent, built into ConOps as well, should be how do we evaluate? How do we make sure that next time we're better? What do we learn from what we did? The whys of this. It provides this narrative, process to be followed in implementing a system. And again, in this case, it's about assessment and monitoring of medical countermeasures. defines the role, as mentioned earlier, of the stakeholders involved. And it's a methodology to realize the goals and objectives of the system. And whether it'll be specific CONOPs set up for this, the monitoring and assessment, I think that's one approach. The other one is that these CONOPs need to be built into bigger CONOPs, which is the response CONOPs that exists out there. We can talk about that later. The threat response, as I mentioned in my opening words, it's about the all hazards approach. And the goal is MCM active monitoring and assessment capability during an actual or potential public health emergency response. It allows us to pool, to analyze, to share information to guide the MCM use. And as Carmen had mentioned, you know, it's not just future-oriented, right? It should be vibrant enough with these CONOPs that we can be reactionary, right? In the midst of a public health disaster, public health crisis, we should be able to get that information and say, aha, this is what works. So let's keep this up. Let's make sure it's used. But at the same time, it needs to be good enough to say, well, this really sucks. This doesn't work. That we be able to pull out of that and come up with something better. And of course, make us better for the future, right? The idea that we can monitor these things so that we learn from it for future events. So the key feature here is it's got to be utilizable in the same event or subsequent events. And how does this connect to the broader discussion? Right, we explore and identified methods and strategies of this integrated approach that can facilitate harmonizing a key word, MCM data collection. Data needs to be robust, as I mentioned, to translate its findings. There's various stakeholders involved. There's various levels of existing resources and capabilities. There's various methods of distribution and dispensing. They all have to be tied in. And again, we'll talk about the other domains, but this is managing, CONOPs for managing this MCM data collection across the domain areas of EHR, big data, clinical networks. We have roles that need to be defined, industry, regulatory management plans, response, clinical trials. And most important, and this is something I think, Perrin, that you kept sort of emphasizing in our work group, this can't just be a piece of paper, right? It can't just be a piece of paper saying, okay, we're done. We've written up a CONOP, we feel good. Guess what, folks? Unless we're exercising, unless we're doing, unless we have the capabilities, and yes, I dare say the funding to do these things, to be able to use something for the first time in the midst of an emergency, that's our bad. Right? That's always going to be fraught with danger and error, and then we just squeak by and say, well, we did it again, right? We adjusted in the midst of something real. But at that point in time, what do we have? We have people's lives at stake. We have people's trust at stake. So the issue of exercising, of having that capability built into CONOPs, I think is critical. So thank you. With 5 seconds left, I'm off to give a commencement address. Congratulations.